Hello, I'm Dr. Robert Biscup, founder and president of Biscup Spine Institute. Throughout my 25 years as an orthopedic spine surgeon, I've been very fortunate to be associated with some of the finest doctors in the world and in developing some of the newest and cutting-edge technology available. I was one of the first surgeons to perform spinal fusion surgery using pedicle screws and plates with my former partner, Dr. Arthur Steffi. Dr. Steffi is credited as being perhaps the founder and father of modern-day spine surgery.
Dr. Biscup had been with us in training as a resident. He came back and spent a year as a fellow with me. Fellow meaning an extra year of postgraduate training above and beyond what you needed to have in order to be an orthopedist. So this was an extra year that he spent in spine surgery, and he was probably, of all the young men that trained with me through the years, one of the best, most talented fellows that I ever had. Talented enough that I asked him to come and stay and work with us.
We would typically see patients from all walks of life in all corners of the world with simple and complex problems. Throughout my career, I've practiced at such prestigious institutions as the Cleveland Spine and Arthritis Center and the Cleveland Clinic Foundation.
Bob joined the Cleveland Clinic and became sort of their senior spine surgeon. The president and CEO of the Cleveland Clinic, who himself was a thoracic surgeon, asked Bob to operate on his own back, on the president's back. And Bob did with very successful results.
At the Biscup Spine Institute, we specialize in many facets of spinal medicine and spinal surgery. Throughout my career, I've been fortunate to be involved in many exciting developmental projects, both in the areas of major reconstruction spinal surgery as well as minimally invasive surgery. I was actually the first surgeon in the country back in the late 1980s to use the holmium laser for spine surgery applications.
Such simple things as taking out a disc herniation, doing a simple laminectomy or decompressive laminectomy can be done, if you're talented enough, through a small, little tiny incision, micro incision. And Bob is very capable of doing that. He's one of the few surgeons who, in addition, uses in his armamentarium lasers and all kinds of other instruments that many of us never really learned to do because they were brand new at the time.
One of the most common questions we're asked at Biscup Spine Institute is, do we do laser spine surgery? And the answer is yes. We began 20 years ago developing the techniques that are used today by myself as well as others. Let me also say that the laser is a tool. Just like any other tool or instrument that we use in surgery, it has its applications and it has its limitations. The laser is really only as good as the hand of the surgeon who's using it. During the initial evaluation process, once an individual contacts the Biscup Spine Institute, any imaging studies that are provided to us, I personally review. It's very important for me as a surgeon to study and look at the anatomy myself. And today, the best way to do that is through the imaging studies that we have available, including MRI scans, CAT scans, and X-rays. Another question I'm often asked is, Doctor, are you going to do the surgery? And the answer is yes. I perform all of my surgery. I do have very qualified assistants with me, but every aspect of your operation is being performed by myself with over 25 years of experience and tens of thousands of cases.
Hi, my name is John Boer. I'm a physician's assistant. I've worked with Dr. Biscup for the last 24 years. We first started out in Cleveland at the Cleveland Spine and Arthritis Center with Dr. Art Steffi, and practiced there until we joined the Cleveland Clinic in Cleveland. At that point in time, we were able to develop a institute for failed back surgery, and really brought a lot of different techniques into what the Cleveland Clinic had to offer from their spine department. I've known Bob both professionally and personally as a friend, and Bob's actually operated on my back, and we've enjoyed a really good relationship over the last 24 years.
The work that he performed on my back cannot ever be appreciated in words in my vocabulary. Thank you, Dr. Biscup, and continued wonderful health and success.
Hi, I'm Dr. Lloyd Micels, and I'm a patient of Dr. Biscup. I had back surgery for stenosis 4 weeks ago at L2-3, L3-4, and L4-5, and I'm doing just wonderfully. I've been so well treated by the people in the office, and I'm so delighted with the results. My recovery has been uneventful, and I'm out of pain totally, and looking forward to getting back and doing all the normal activities that I enjoy doing. I've been totally satisfied, and this is my 4th back surgery, my first with Dr. Biscup, and by far this has been the best experience I've ever had.
What Dr. Biscup did for us, it's amazing. It changed our lives. In a matter of, a week now that he's had surgery, he can walk. No complaints. I'm sure it's only going to get better from here.
Yeah.
And we're just thrilled. We went to 4 different specialists or surgeons in Canada and in California, and nobody could solve this medical problem for us.
And also about the, you can say about the staff and
the staff here is amazing. I have never encountered anyone who helped us throughout this whole preparation before coming down here, with service, with getting our hotel reservations or transportation, anything. It was just amazing. I can't thank them enough. Thank you very much, Dr. Biscup.
One of our goals at the Biscup Spine Institute is not to perform the most surgeries in the country or in the world. Our goal is to perform the best surgeries with the best outcomes and have a close and intimate relationship between me and my patients and our staff.